Welcome to the Bethlehem Corner. My name is Janine Santoro, and I currently serve as the Director of Equity and Inclusion for the City of Bethlehem. Today, we're meeting here in front of the beautiful Hope Center on Broad Street to talk about our Community Connections program with members of our Health Bureau and our Police Department. Thanks for joining us.
So about a year and a half ago, in response to the community health needs assessment that the city does every 3 years, we found that the three most unmet needs in the city were mental health, home assistance, and elder care. And we wanted to respond to these needs and figure out the best way to serve the residents who are having these unmet needs. So the police department and the health department, we collaborated and we looked at programs around the country to see what other communities were doing to figure out how they are addressing those problems.
And I can say that since the start of the program, we've helped numerous individuals with either homeless or drug addiction or a variety thereof get back on their feet, specifically one individual back to his home state.
Exactly. And so the goals are to meet the need where it is. The officers are in the community every day. They're our eyes and ears. They see this need. So they either call us and have us come meet them in the field, or they can send us a referral through an internal referral system, and we can reach out to the clients through that. So it's been a really great and very successful collaboration.
Our goal is to basically be able to connect our Bethlehem residents to social service resources when they most need it.
One of the misconceptions about the program is often that this is to replace actual police response, whereas this is actually a way to enhance police services, as our social workers are not out 24 hours a day, 7 days a week. We have the ability to do a referral in our reporting process, and Lori would receive those referrals and has the ability to follow up and provide social services to hopefully help prevent police responses to incidents in which social services would be a more appropriate response.
Absolutely. And then one of the greatest things is that we actually continue to follow up with these individuals and families, because we do 30-day, 60-day, and 90-day follow-up. So we're just making sure that they stay connected, or if they need additional services, we're there to help them get connected to those services as well.
So the police department is on the field, boots to the ground, and ready to serve the community at all times. And when they encounter individuals who need a level of care that is more intensive, or just need to have someone else come along with them, they reach out to us and we respond to either on field with them, or they provide a referral through the referral system.
There was a female, homeless female in the city that I had multiple contacts with, trying to connect her to services. I know other officers did outreach as well. This female was also the victim of domestic abuse. She actually came to the Hope Center here. She was connected to services here and reported this. We were able to make an arrest in that case on her abuser. We were able to connect her to services. She's still in treatment as of today and doing well. I just spoke to her as of a couple days ago.
We had a gentleman who was struggling with both mental health as well as drug abuse. We believe some of his mental health may have been exacerbated by the drug use. We're able to utilize personnel from the Hope Center who came out to the scene with the Community Connections group, and his experience with prior addiction assisted him with getting the male to open up and communicate. And by doing so, we're able to get that male to come in to the Hope Center, where he was able to obtain drug treatment as well as mental health treatment. Up until that point, the male had been facing an eviction from his home, and because he was able to get the assistance he needed, the Bethlehem Housing Authority rethought the eviction and gave him another shot.
So as far as the Hope Center, opened in July of 2020, just 3 of us, 1 office, and now we have a staff of over 20. We have the whole building, and it's just full every day with resources, support, people that care.
Police are out there every day doing a really great job, and when they see a social need, they want to help. They can't always take time out of the job that they're supposed to do to help, even though that's what they really want to do. So now that they have us as a resource, they can call us and they can go and continue to do the important police work that they need to do, and we can go out and start to address those needs. So I think that it's something we would love the citizens of Bethlehem to be aware of, because we are there working together to build that web with all of our other community-based partners. Like I said, we couldn't do it alone. The Hope Center, Lehigh County, Northampton County Crisis and Children and Youth, and all of our area resource agencies were all coming together to make this a really, really good community connection.
And I just add one more thing. More importantly, we've built a lot of relationships with our community just through this program alone. Being a part of the crisis negotiations team, I can tell you that the Health Bureau is pretty much partnered up with us, and they do show up on not only just day-to-day calls in the community, but also when someone is in crisis, which is very helpful.
The mental health crisis, it's big in Bethlehem, it's big all over the world, frankly. Mental health is a very unmet need globally, so that we can go out when someone is in mental health crisis and go right where the need is and meet them there has been hugely helpful for those in crisis, getting them connected to the services they need to help themselves get better.